This segment of DelmarvaLife is brought to you by TidalHealth.
All right, pop quiz. What is pre-operative education? The prospect of serious surgery can be intimidating. I think we'd all agree on that. TidalHealth wants to make sure that the process is as painless and as streamlined as possible.
Yeah, their pre-operative education is designed to promote a positive patient experience as well as reduce the risk of readmission or infections. And here to tell us more about the process is Cheryl Presto. She is a surgical spine coordinator with TidalHealth. Cheryl, thank you for being here.
Thank you so much for having me.
First of all, what is preoperative education?
Well, that's what I do. Preoperative education is designed to help the patient be better prepared for their surgery. We go through a lot of things, and sometimes it takes an hour to an hour and a half to get all the information out to the patient. We talk about things like how to do your pre-surgery showering, because there's special bathing that patients have to do prior to surgery to help reduce risk of infection. We talk to them about their preoperative need to not eat, but yet we actually provide them with a special drink that they'll have prior to surgery. How to make sure that you have the proper things that you need if you're going to need a cane or a walker. All of those things are reviewed during class.
So you say class?
Yes,
I was
class.
going to say, how do you present this to the patient? Do you have to be there in your seat and with a tie on? And
yes, exactly. You don't have to wear a tie. That's
okay.
Okay.
Right.
But we actually bring patients into a classroom environment. Our location is actually across from the Acme grocery store right on Route 13. We have a large building, a TidalHealth building, and we have a classroom in there. We can hold up to 14. We do encourage them to bring a caregiver or someone with them, because sometimes patients are very nervous or apprehensive, and having that second set of ears helps. Plus the fact we look at surgery as a team effort, and that patient is definitely going to need a caregiver when they get home from the hospital.
Yeah. So a class, how do you make sure they retain everything? There's not a test, is there?
Actually,
oh no!
Good question, Lisa.
Yes, it is a very good question. We actually do a little bit of a quiz at the end, and we ask everyone a few questions, but we have them answer as a group, and we allow them a very lengthy question and answer session as well at the end.
So explain to me how this helps with the process and with the caregiver afterwards, what they do. How does it help?
Well, this actually helps optimize recovery. We have found that preoperative education has reduced our readmission rates because patients know what to look for when they get home, and they know when they need to call their surgeon versus when they need to call 911. They understand the importance of walking after surgery. They understand the importance of what they can and can't eat or drink after surgery. They also learn how to take care of themselves, how to do dressing changes. If they're having a type of surgery that requires a walker, how to use it. We also are able then to look at discharge planning, which is probably a question you might get to anyway, but we look at discharge planning for our patients because discharge planning actually starts before you ever come to the hospital. I know, people don't think that. They think that we look at discharge a day or two before you go home.
When you get there.
No, it doesn't. We actually start that in the classroom, and we do questionnaires with our patients that score them, and with those scores, it allows us, the nurses, to have a determination on whether that patient might need home health services when they get home, whether they might need to go to rehab, which is never our preference. We want patients to go home, but it helps us guide what the patient might need when they get home from the hospital so that they can have that really great recovery.
That's what it's all about, is recovering.
It is.
Yeah, Cheryl Presto, thank you so much
You
for
are
coming
very
in and
welcome.
talking about this very important subject.
Absolutely.